We got about 3 minutes until 6:30. We've got 3 people joining us so far. So welcome, welcome. So Sarah, I'll ask you, do you know anybody on the screen besides Rachel?
I do not.
Okay, awesome. We'll get to know each other real well tonight. Super.
Okay, good deal.
I'll get this figured out one way or the other, y'all. On your screen, do you see a gallery? Yeah, okay. You figured like by the 3rd time I would be a pro, but you know, if you're only using it 3 times, you know, every 3 months, it's like, got to relearn it. Love it. Well, how are we feeling tonight, y'all? I'm excited. Whoops, didn't mean to do that. I'm super excited for this panelist, and I'm excited that we're bringing awareness to this topic, and that y'all said yes to doing this tonight, and not knowing anybody. I don't think I know any of you, and I'm really excited to learn more about what you do in the community and your expertise in the things that you do for folks who are going through domestic violence or intimate partner violence. So just a little bit about me. I've been with A Step Ahead now for soon to be 3 years. And I am the outreach manager, health educator, and I primarily work in the Hamilton County region, but I started all over, doing all of our service areas. So the people that you serve, I was trying to reach those folks. And now we have a group of health educators here to help us do that. And that's where the wonderful Rachel Endo comes in, who has expertise in public health. And so I would like Rachel Endo to introduce herself as well.
Hey, I'm Rachel Endo. I've been with A Step Ahead since December of last year, so not quite a year yet. I'm also a health educator. My primary counties are McMinn, Meigs, and Ray, but kind of fill in wherever we're needed a little bit. So yeah, I'm really glad to be having this discussion tonight. I think intimate partner violence is something that we definitely need to talk about more, and so is reproductive health. So I think just combining the two and having a discussion about all of it and how it impacts people is a great move. So
yeah. So as you know, as our partners here, I'm so grateful that you said yes to having this kind of tough conversation that is needed in our community and across the state and the nation, we all know. So tonight, what we're going to do is we're actually going to introduce them here in just a few minutes. So you'll get to know them a little bit more about them. But I do want to start off by talking a little bit about A Step Ahead as an organization. And our mission is to remove barriers to contraception through education, outreach, and access to free contraception. We believe that when individuals have access to accurate information and access to contraception, they're better equipped to make decisions that are right for them and their families. And we believe that having access to those health services should be provided free of judgment in a caring and respectful manner. And our services at A Step Ahead are open to all individuals who are in need of education and access to birth control. So we serve a large area of 18 counties. We serve the 13 Southeast counties, which many of you serve as well. And we also just opened our doors to folks in Northeast Alabama and North Georgia as well. So everything that we do is provided to them. If they live or go to school, they get our services for free in those service areas. So I want to introduce our panelists. So I'm going to go ahead and pull up their lovely faces. So maybe you've seen this on social media, but I would like Dr. E to introduce herself and the work that she does, but she oversees the crisis service program, and it includes both the Rape Crisis Center and Domestic Violence Crisis Center at the partnership. But Dr. E, can you add a little bit more?
Sure, I'd love to. Yeah, so I work for the Victim Support Services Department within partnership, and crisis services fall under our jurisdiction, and that includes both domestic violence and sexual assault, as Michelle said. So my department, there's two branches. There's the DV side and the sexual assault side. And so we have a hotline that folks can call in, talk to one of our crisis advocates, and kind of we call it centralized intake, kind of get routed through our services and help figure out what we can do that will best help meet folks' needs and provide those services to our community, and work a lot with our community partners to try and help these folks.
That's amazing. Thank you for sharing that and taking a little bit more to, where you're at. I didn't know that you had such a unique center that you were able to help folks that call and then direct them to where they needed to go. So I'm going to be learning a lot. I know that for sure. So Sarah Cannon is the Training and Outreach Director of the Avalon Center for Domestic Violence and Sexual Assault in Crossville, Tennessee. And the Avalon Center serves Bledsoe, Cumberland, Fentress, Morgan, Ray, Roane, and Van Buren counties. And Sarah, can you add on to that?
I can. Thank you for having me. I have been with the Avalon Center for 15 years, and I am now the Training and Outreach Director, but the Avalon Center serves 7 counties, and we are a dual program that serves domestic and sexual assault victims in various ways. We have a shelter. We also have the crisis line. We do crisis intervention. We go to court in all of those counties with our clients. We have a children's program. We offer professional counseling. We do batterers intervention programs. We have a whole host of services that we provide to include community education and prevention education in all of those communities as well. So as the Training and Outreach Director, I go into the communities and work with people on collaboration to get community partners, but also work with them on that community education piece to educate folks on domestic violence and sexual assault, to make sure that our clients are receiving good services from other collaborators that they are encountering as well.
Wow, that's a lot. And I'm so grateful that you're here. Maybe you might find somebody to connect with as well. So thank you for sharing. And we also have Christina Paula Castro. Did I say that right? Awesome. And and Christina is a UC Foundation Associate Professor of Criminal Justice in the Department of Social, Cultural, and Justice Studies at the University of Tennessee, Chattanooga. And the primary research interests are in the area of victimization with specific focus on elder abuse and intimate partner violence. Hi, Christina.
Hi. Thank you so much for having me. I'm excited to be here and chatting. Yeah, like you said, I'm a professor, so I come at this from an academic standpoint. My primary research interests have been in IPV. I've done a lot of work on stereotypes and misperceptions, as well as risk factors, as well as looking at sexual violence. I've worked with the Tennessee Coalition overseeing their Tommy Burke's Victim Assistance Academy. I think the Avalon Center has sent some folks in partnership too, so I help facilitate that in the summer. And I work a lot with college students. We're a high-risk population, so really excited to be here and talk about adolescents and teens as well. So
fantastic. Yeah, that's a great perspective to have. Thank you. And then Lindy Rogers Silver. Thank you for being here, Lindy. Lindy is the president of Blessed Inc., and they provide emergency services to women and children as they escape violent homes. Their future plans for Blessed Inc. include working to build a safe home inside Marion County and bring affordable housing to the community and increase resources to women. So Lindy, tell us a little bit more about you.
Thank you. Thank you for having me. I am so excited to be here and make connections and just learn as much as I can. I am the founder of Blessed Inc., a nonprofit here inside of Marion County, and we provide emergency resources to women and their children as they leave abusive homes. So we're able to provide food, clothing, emergency only shelter in the form of hotel rooms. And we're even getting into RVs, campers, tents, anything that we can do to keep people out of violent situations. And we have been active in our community for 2 years. Post-COVID, we started all over again, and we've been back in the community for about 6 months. And women are coming to us for services more and more every single week because the need is critical.
Wow, that's amazing. Thank you for what you do and what all of you do. It's an important work. So again, thank you. And I'm so excited to get started. So I do want to cover our agenda real quick. And our agenda is we're gonna talk about what IPV or intimate partner violence is, and sometimes it's often called interpersonal violence as well, right? Which I'm learning, and then we're gonna get into how IPV can affect access to reproductive health, and then we'll talk about the numbers behind interpartner violence. And then I have a poll for the audience just so we can kind of see who's here. And then we'll jump into a panel discussion and then any questions, of course, from the audience, and we'll talk about some resources as well. So let's go ahead and jump in. Rachel, take it away.
Okay, so what is IPV? Intimate partner violence is abuse or aggression that's directed at a romantic partner. You may have heard the term domestic violence as well, and these kind of mean the same, but intimate partner violence is a little bit more inclusive of people who don't live in the same household, where a lot of times if somebody hears domestic violence, a lot of times they just assume that it's people who cohabitate. So intimate partner violence is also looking at teens, at adults who don't live together, and other kinds of relationships like that. So intimate partner violence includes physical violence, sexual violence, psychological aggression, and stalking. And I feel like it's really important to bring attention to those last few, because I feel like everybody pretty much knows that the physical violence part is wrong and is intimate partner violence, but sometimes the sexual violence or the psychological aggressions or the stalking can be just considered, you know, maybe an unhealthy behavior, but a lot of people try to brush those off sometimes. So how does intimate partner violence impact access to reproductive health needs? One of the biggest ways is through reproductive coercion. Reproductive coercion is a form of abuse in which an abuser interferes with an individual's decision-making in regard to their reproductive health. So this can take the form of a birth control sabotage, where maybe an abuser flushes all the birth control pills or takes out an individual's IUD. It can be pregnancy pressure, where an individual feels like they have to become pregnant, or their partner will hurt them or in some way do something to them, or controlling the outcome of a pregnancy. And this one can kind of go either way. Either the abuser is forcing the victim to keep a pregnancy, or they force the victim to terminate the pregnancy or miscarry. So as you can imagine, all of those are pretty harmful to a victim, and can have a lasting effect on their reproductive health. So we're going to talk a little bit about the numbers behind intimate partner violence. So about 1 in 4 women and 1 in 10 men experience intimate partner violence at some point in their life. So statistically, you know, just with us panelists here, there might be like 1 or 2 of us who have experienced it. And, you know, 1 in 10 men, those are kind of alarming statistics when you really break it down and think about it. 1 in 5 homicide victims were killed by an intimate partner when you look at all the homicide data. 7 in 10 women who are psychologically abused develop symptoms of PTSD and depression, in addition to mental consequences of abuse. There can also be some other negative health outcomes. Individuals who are abused can have heart issues, reproductive issues, and digestive issues as well that come from as a result of the abuse. And finally, about 20% of women seeking care in family planning clinics who had been in an abusive relationship said that they had experienced pregnancy coercion. So, and then if we look at Tennessee itself, about 39.6% of women in Tennessee have experienced intimate partner violence, whether it be the physical violence, intimate partner rape, or stalking at some point in their lives. And actually, males' rate isn't much lower. In Tennessee, males report a rate of 36.8%. And so both the male and the female rate are higher than the national average. In Tennessee, there were 73,568 domestic violence offenses that were reported to the police in 2018, and 71% of these calls were from women. And about 9.8% of domestic violence victims are juveniles. So again, this isn't a problem that is only affecting adults or only affecting people who are married. This also impacts teens as well.
Yeah, so I before we move into our poll for the evening, I do want to point out that a lot of these topics may kind of cause some trigger points, or may make you feel, you know, if they make you feel unsafe, or just take a time out, take a breather. At any point, you know, we're just trying to bring awareness, but we also want to cultivate a space of safety. So for my panelists too, like at any point you need to turn your camera off, feel free to do that. And I know we're here to offer a safe space, and with polling, you don't even have to answer if you don't feel comfortable in doing so. So I just wanted to put that out there. Let's see if I can get my poll to start. All right, y'all, I'm gonna stop sharing just for a minute. All right, can y'all see the poll on your end? Okay. Now can you see the poll?
There it goes.
Yes. Okay. Fantastic. So there's only 4 questions.
And just while y'all are filling the poll out, we wanted to let you know there is a Q&A option at the bottom. So if you have any questions as audience members that you would like addressed by the panelists or by Michelle or I, just feel free to put that in the Q&A and we'll get to it.
And we have about 41% that have participated so far. So thank you. We're halfway with participation. So while we're waiting for a few more folks to answer, I do want to kind of go over the way we're going to do this discussion tonight. And that is that we have about 10 questions that Rachel and I came up with that we're going to ask kind of a popcorn. Rachel and I are going to take turns asking our panelists, and you can answer, just raise your hand. Panelists, feel free to hop in, whenever you feel ready to answer a question. And it can just be, we take more time on one question than the other. So, and that's how we're going to conduct it, just very informal, if you will. So we have about 75% participation, which is, I think, pretty good. All right, I'm going to show our results. Can y'all see it? Okay, so we have about 100% of folks who said that they either work with a client in an unhealthy relationship or somebody dealing with domestic violence, which we figured, right? Why would you be here? Maybe. Number 2, are you someone who has faced an intimate partner violence in your lifetime? And we have 44% that said yes, and 56% that said no. And then number 3, do you know the domestic violence resources available in your area? Wow. So 56 said yes, and 44% said no. And then last, do you know someone who has struggled getting reproductive health needs met because of domestic violence? And 33% said yes, and 67% said no. So that's who's in the room tonight. Excellent. I'm going to turn my music off. Good deal, y'all. So, Rachel, you want to start us off with the first question?
Sure, I'll get us going. Okay, lovely panelists. Our first question is, and you can answer this from either an abuser perspective or a victim perspective, but what are the most common misconceptions that you've experienced or heard about intimate partner violence?
I'll jump in. I had a note in my list about this, but one of my staff members was providing court advocacy with someone today, and this kind of came up, and so it was on my mind, but that domestic violence or intimate partner violence is an anger management or impulse control issue. And that can certainly exacerbate things, but it isn't just that. And the situation today, in court was that the judge was just going to recommend anger management, and the advocate actually kind of jumped in and said, wait, is that it? We have domestic violence forensic exam evidence, we have all of this going, and it actually ended up kind of going another way. It ended up being bound over, and so I was really proud of my advocate today. But I think that brings up that point that a lot of folks think that, oh, it's an anger management issue. This person who is aggressing towards another person just needs some anger management classes and that'll resolve the issue. And it's not, it's about power. There's a lot more forethought that goes into it. It's not just the impulse control.
I think that also relates to something you see in the literature about this idea of abusers being very different from everyone else. They must have some sort of mental illness or be deranged, when, it's about control, it's methodical, it's selective, they're typically not out there. We've all seen the PSAs of from Canada that kind of show abusers lashing out when the waitress spills coffee. That's not what they do. They target their partner. And I think it allows people to separate themselves, that misconception from the victim and the abuser, and have this idea that it's kind of this reactive abuser and possibly a provoking victim, which is a huge myth you see out. And I see play out when I teach victimology all the time of, trying to understand why somebody would do that to somebody they love. There must be a reason, which it's a control tactic.
I would say also going further from that is that drugs and alcohol cause domestic violence. And so that's also plays along with that whole mental health issue, or that it's an anger management issue, that, well, there's a reason why this happens. Everybody struggles for a reason, right? And so we look for that. And so if I wasn't drunk, or if I wasn't using drugs, then I wouldn't do these things, or my partner wouldn't do these things to me. And so we hear that a lot on both sides, from victims and abusers, that it's the drugs and alcohol that cause this. And so obviously that doesn't happen, because everyone who gets drunk or gets high doesn't abuse their partners. So it is absolutely a choice that is made. And if you look back, when they're not using drugs, they're still using those power and control tactics. So that's a big myth around domestic violence. I think another one that we hear is also that, and it also goes along with sexual violence, is that it's exaggerated, or that it's a lie. And a lot of people still don't believe that it happens, especially if there's not physical abuse included. And so it can't be real if there wasn't any physical abuse. So, and people just say this because they want to ruin somebody's life, or they're making this a bigger deal than it was, because they know that this can get them in trouble or whatever. And so, that's a big misconception, because those non-physical abusive tactics are just as damaging, if not more damaging, than those physical tactics are.
Yeah, I think Sarah said it very well. But when we have victims come in, if they don't have bruises, or if they haven't been to the emergency room, then they don't feel like they've honestly been abused. And it's just a really sad situation to watch and to experience. My ex-husband was an alcoholic. He still doesn't remember ever laying hands on me. And it's the hardest thing as the victim to also face, knowing that they're never going to remember the damage they did.
Thank you for sharing that story, Lindy, and all of your answers. Like, I'm just over here. Yes, I agree with all of that. And we don't think about the things that, if we can't see it, it's not happening, So I appreciate all of those answers. So a lot of abuse behaviors are normalized in our society. How can we work as a society? And I know that's a big ask, but how can we work as a society to begin changing this? So that's like a one part. Any suggestions that we could do better at?
I think just challenging those things when you hear it in conversation. Those everyday little changes, because when we think about it as a big whole, it's really intimidating, right? Like overthrowing this culture where it's glorified in music, it's accepted in sports with athletes and high profile folks. So just kind of like in those everyday conversations, challenging that, like, when people minimize and when people, justify it. Like, you don't have to be abrasive, right? Just saying things like, hey, have you thought about that? Like, the idea that you're not hurt if you're not bruised. Well, physical or psychological violence is really damaging, and there's actually stuff out there that shows it's linked to the negative health outcomes Rachel talked about. So very severe. When you actually talk to victims, they view it as worse sometimes than the physical abuse. So I think a big part is just talking about it more and challenging it. And sorry if there's noise behind me. They're like doing something above me in my office building.
I also think that, as a society, we are a little, like she said, because it's accepted in media and different things, we're kind of desensitized to it. So we don't, we kind of excuse it in a lot of ways, right? And so, and that's a whole nother debate we don't really have time to get into, but, that whole piece about challenging it, not abrasively like she suggested, because I agree with that, but we tend to excuse bad behavior more and more these days because we're learning more about trauma, right? We're learning more about how people have been affected by bad things that have happened to them in their lives. And so as we do that, we tend to excuse even abusers' bad behavior more, unfortunately, I feel like. And so just because you have had bad things happen to you in the past doesn't give you a pass to continue to behave badly. That's not an excuse to do that. And so I think you can still challenge that behavior and still hold people accountable for their behavior just because something bad happened to them. But we tend to err on the side of, well, they didn't really mean it, or, they had a really hard life, so we just kind of let those behaviors slide and that kind of stuff, instead of challenging that and holding them accountable. And I think we do that more as a society or as a group, starting very young with people because they've had those bad things happen to them. And so then they grow up to think, oh, well, I can get away with that, or that's acceptable behavior. And then they get into relationships and it's not acceptable behavior. And so then we have judges trying to tell them that it's not acceptable behavior. And so that doesn't work as well. So we have to start younger, and we have to, say, yeah, that was really bad that happened to you, but you still have to be responsible for your behavior going forward.
100% agree with all of that. And I would extend it to, I think, making the resources more visible. I think that there's a message sent to when a resource exists for something, then it means it's an issue. And so when people are able to really visibly see the resources available around a particular issue, they recognize it more as an issue, as within a community and a society.
And this next question is kind of along the same vein. So if it's just a reiteration, sorry about that. But how can we raise awareness for abuse that is not physical? So how can we raise the awareness for the psychological violence, the verbal abuse, sexual abuse, financial abuse, and digital abuse?
I think that one goes to education and providing more resources, educating our community, just like webinars like this, and providing those resources that we are lacking. This area of the South is lacking resources, lacking support, and the women, our communities, they have no idea what's even available.
I agree with that. And I don't mean to answer every question, but I think that, I teach our batter's intervention class, and there's some really basic things that we talk about in there. And I've been doing that for 15 years, and it still amazes me in some of those classes that that's the first time that some of them have ever heard those things. And so, we teach a lot of things in school, and a lot of things in churches, and a lot of things all around all of these topics, right? But, we teach an abundance of things, but basic things about healthy relationships and communication and fair fighting and things like that. You should not wait to adulthood to hear those things, right? So somehow, some way, we have to get those messages out there a lot earlier. And so I agree with what Dr. Everett said, that when you put the resources out there and make them more seen, people know about them and think, oh, this must be an important issue. So let's pay more attention to that. And you think that people know that need those services, that they're available, but they really don't, unless you're doing good outreach to the people that need it, because victims don't often recognize their victims until it's right in their face. So
I think you make a great point about getting to different audiences and being creative about how you do that, like especially faith-based communities. I mean, even the medical community, like chatting with, I'm meeting with some nurses from Erlanger's Nurse Family Partnership in a couple weeks to talk about, how they're intervening early on with children, trying to make healthy outcomes. And I'm talking about IPV with them. And that's an audience I never thought I would talk to early on. And I think talking about that with them, raising awareness, making it visible, and starting really early, because like you said, once we get to the court, once it's too late, it's harder to turn back the clock then. And having that intervention and early on to like raise that awareness, prevention, about resources, I think that's vital. And, I try to do it with college students, but then it's like I hear horror stories about what they experienced as children and in high school. And it's like, it's just kind of, it's kind of disconcerting, but like being more creative about how we can partner and like creatively across these different groups. It's hard. We're all stretched thin, but it is possible. I think it's right on the point.
Well, I think that's something we have not talked about is we've talked about the physical and kind of the psychological, but what about the financial aspect to all of this? What about that? I feel like, that's a resource, right? So like if you're in a domestic violence situation, having the money to leave is an issue, right? So what about financial? And I'm going off the cuff here because this is something that, in talking to people is a huge barrier. Not only knowing what your resources are, but knowing that you also have financial support somewhere. So does anybody have any advice or support on that when we're talking about within our community for financial support when trying to leave?
In our experience, that's the number one reason why people stay. They stay in the relationship because of the financial situation. They stay for the house because of the stability. They stay because there's food in the cabinets. They stay because there's a steady paycheck coming in through a spouse. And the financial aspect is the biggest hurdle to overcome.
And it is really tricky. That is one of the most difficult resources to help line a person up with. And there are some good options. There's some good help, but a lot of times there are maybe kind of rigid criteria that a person has to meet in order to access some funds through a particular source, or that it's just very limited. So that is such a tricky resource. We really do need more. I guess we always need more money. Always comes down to needing more money.
And I think the key to that is when you leave, and we can get you some things right from the start, right? There's lots of resources to get somebody out not lots, that's a poor choice of words, but there might be some resources to get you out, like to get some food in a cabinet, or to get you a hotel room for a week or so, but it's sustaining that for a long period of time. And so it's, you know, how do you maintain yourself at the current lifestyle? Because you're talking about, you know, you're going to be a single person and have these children who are accustomed to this lifestyle, and you're going to take them and they're going to have what? Or you are been accustomed to this lifestyle and you're going to have what? That's a hard decision sometimes. And so people don't really think about what we're asking people to do when we say, just leave, or why don't you just leave? You know, that it's more than just one physical act of just leaving. It is definitely a process.
Yeah, and that, I mean, you kind of jumped into my next question, which is like, why do people stay? We know they stay because they don't have the money to leave, or you know, a lack of resources. But what are some other reasons that y'all see in your work why people do stay in these situations?
There are so many, and they are so individualized. I think one of the ones that we do definitely see a lot is fear and danger, and that fear and danger is very real. That sometimes leaving puts them at a greater risk than staying. And when they stay, they kind of, even though it's a really hard normal, it's their normal, and they kind of know what to expect. And they know how to deal with that versus all of the unknowns of, if I leave, I have no money, maybe I have no car, I've got 3 kids, what do we do? And that uncertainty as well, and the fear of what's going to happen next, as well as love. And that kind of goes into the misconception piece that, oh, you can't love somebody who's, you know, punching you in the face. Sure you can. Sure you can. You can love them. You can have hope that things are going to get better. You have children together, maybe. You want to hold it together for them. So sorry, I don't want to take all the reasons.
No, that's good. That's a good start.
I'm so glad you brought up love, because that's the one, when I talk to students, they have the hardest time wrapping their heads around that and think that's so silly to say. And I'm like, but these are human relationships. And, you know, you're typically not with somebody if there's not emotion involved. And that's a legitimate reason to stay with somebody, and a hard thing to break. And that emotion, that connection. And then on top of that, just the control, like the mental game that plays with someone's head, and what that does to your psyche, your self-esteem, your worldview perception. When we're talking about coercive control, where you had your behavior regulated, this omnipresent person in your life, that is a real reason to just stay. And like, that's a legitimate reason, and it has a rational thought process behind it that I always say, you don't know what you would do until you're in that position and you've felt that. And I think people forget that, or don't even realize that goes into it. It seems so easy just to cut that off, but you know, it's not.
When I explain that, I usually tell people, you know, you don't go out on the first date with somebody who has that plan for you in mind, and go on your first date and order the wrong thing for dinner, and they reach across the table and slap you, and you say, oh, this is what I've been waiting for my whole life, right? And so now we're in love and we're going to be in this great relationship. That's not how it works. And so it starts out as something much more great than that. And so there is absolutely this great relationship outside of the abuse. They actually lay on the couch together and shop and have good times. that's not what we see necessarily as advocates or hear about, but those are the things that they remember when they're trying to leave. That's where the love comes in. And so those are real things though that they think about. And so, you know, it's a lot easier to remember those things than it is the bad things when you're trying to leave those relationships too. And so, I mean, it is very real. I would also say that, you know, to us, sitting on this side of the desk or this side of the situation, you know, fear is relative, right? And so to me, I would be afraid of, you know, getting punched in the face or having a broken arm or whatever. But to somebody else in that situation, fear might look really different. Fear might be that actual danger of somebody hunting me down or, you know, looking for me and those kinds of things. But it also might be that I don't have anybody to take care of my kids while I work. You know, I might be that isolated from that, or nobody's going to believe me that this is going on because this person is a pillar in the community and they look like they're the greatest person when we go out in the community and they have this great job and they do all of these things. And so nobody's ever going to believe that this stuff is happening to me. And they've told me that I'm going to look crazy. And so that might be my fear. So fear can look all kinds of different ways. Fear might be that I'm going to get evicted because my landlord said if law enforcement shows up here again, I'm getting evicted. You know, and so it could be a whole lot of different things, but sometimes we, and fear could be just what she described it as earlier, is that, you know, it's like that real danger of something bad is going to happen if I leave. And so it's much safer if I stay because I know what's going on when I stay. So it just is very complicated, and it is very different for every person, I think. And some people, this is what they know. They think this is what is supposed to happen. You know, if this is how you grew up and what has been your life, then this is what you're conditioned to expect. And so this might not be something that you are not accustomed to. And so without that, there seems like something is missing. So
I'll add lack of support, either from friends or from family. That lack of support is a common thread that we see every single day. We would like to think if we were in that situation that we could go to our sisters, or we could go to our parents, or we could go to our best friends. But when it comes down to it, can you really? You know, can you really go home and face the judgment of parents or family? Can you really crash on your best friend's couch with 3 kids for a few weeks? Like, can you really do that? And it's the lack of support. And I get to speak with parents and mothers of these victims, and they'll say, well, can't you house her? Like, we only have 1,000 square feet and we're already cramped. Like, can't you do something about it? And it's just like they care, but not enough to help. And that's heartbreaking.
And I'm going to speak about myself because I am one of those folks who have experienced domestic violence as well. And I will say, I went back so many times that my friends and my family were like, we're done helping you. We're done helping you because you keep going back, you know? And so the lack of support when you're not, you know, doing what they have asked you not to do, you know, but they don't understand. So thank you for all those wonderful answers, y'all. And I think Dr. E, did you have something you wanted to say?
Oh, I was going to extend that, but kind of in response to what you just said, there's a statistic out there that people on average will leave 7 times. Like, it takes that many times. This is not easy. It is not easy. And that lack of support, Lindy, absolutely, that's such a huge factor. And to kind of extend that to, sometimes there's also external pressures to stay, pressures from family, culture, spiritual backgrounds, all kinds of different reasons that might pressure a person to stay. So just adding that as well.
And I want to add, one of our our audience members kind of mentioned, I stayed because I wanted to fix him. Have you guys ever heard that? I know that's one of the reasons I stayed. But I was one of those that went back and forth probably more than 7 times. But yeah, those other reasons that hold us to, whether it's family, whether it's we're trying to solve something, or kids. So all great answers. Thank you. Rachel, the next question.
Yeah, we did have a question in the Q&A pop up, and I thought that it may just be a good one to go ahead and address. So I'll go ahead and ask that, going a little off the cuff. But how can you differentiate domestic violence from a person who has a high functioning mental problem? I feel like this kind of relates back to what we were talking about in the beginning, that a lot of times people think mental illness predicts domestic violence, but how could you tell that difference?
I think we see, like, especially when we think about, just offenders in general, not just domestic violence offenders, like mental illness is a problem. And I would say, even when you look at mental illness, there are some statistics on violence among persons with mental illness. They actually are higher risk of being victimized themselves because of vulnerability. So I think there's a big misperception that mental illness contributes to high rates of violence. And when you look at domestic violence offenders, they might have some mental illness, like we see high rates of depression and anxiety, but we also know that doesn't contribute, like cause someone to be violent. We don't see, there are some studies on like narcissism and, psychopathy, but there's really no evidence that domestic violence offenders are higher in psychopathy and stuff like that. If you're trying to just diagnose someone with mental illness, they're going to have a psychological evaluation. But just when we're talking about on the whole and looking at domestic violence, those offenders are not going to be, mental illness isn't causing it. And it's to differentiate that, you're going to have some kind of psychological evaluation. Noise, sorry. But it's just one of those things where I think it's a difficult question. And yes, there are abusers that have some form of mental illness that might contribute to some of their behavior. It's just like the alcohol question, though. It's not a causal relationship. And, you might even get a person on medication and get the mental illness under control, and then the abuse will still be there because we're going to see the control pattern.
I think you also will have abusers that use that as a reason, right? Or that's a good, I'm bipolar, so this is why I do that. Or I have this mental health diagnosis, so that's what causes me to do these things. But like she said, that's not the cause, because those things were already going on. Or even with medication that controls that mental illness, you still make a choice to be violent. You still make a choice to use control over certain people in your life. So if it was an uncontrollable thing, you, just like she alluded to those commercials in Canada, which is a powerful example, right? Is that we know that you choose the violence because you don't do it to everyone. You only choose certain people to do this with. So if you go to a restaurant and somebody spills coffee on you when you have schizophrenia, you don't get up and beat the crap out of the waitress. But when you go, or you're sitting at home and your partner spills something on you, you lose your mind. So we know that you're making a choice to do that with a certain person because you can, or you have, made that environment as such. So, but then you use your schizophrenia, or you use your mental illness, or your alcoholism, or your whatever ism as your reason that is occurring, instead of taking responsibility for your abuse.
I just want to be over here like, yes, yeah, like clapping. That was really good. We had another question pop up that I kind of feel like relates to what we're talking about in the audience, that says, what about the people that have family members that are willing to help, but every time they try, the victim ends up turning on the family member and defends their abuser? How do we reach them?
So one of the really tough things about this work, I think, especially for new folks coming into the field who have hearts as big as Texas and want to help everybody, is that you can't help everybody. And you have to, it's kind of, we are leading, I do not want to compare people to horses, but the lead the horse to water situation, you line up the resources and they have autonomy to take them or not. And that has to be okay. And some of them are going to choose not to take them. Some of them are going to take them for a minute and go, you know what, I want to go back. And you have to go, okay, we'll be here when you need us.
That one's really hard, but just approaching the situation with love and not criticism is really important. Once you're critical and once you have a negative tone to the victim, then that trust is broken. And just loving them through all of it, just loving them so that they know when they're ready, when their heart's ready, when their mind's ready, that you are a safe place they can go.
Yeah, I think that both of y'all's answers were very poignant and just so relevant. Our next question for you all is, how has the COVID pandemic impacted intimate partner violence? And how has your organization or your community been able to respond to these changes?
We are seeing an increase in women needing help, needing support, needing resources, or needing to leave violent homes because work used to be an escape, or school used to be an escape from the home. And now they're all working, living, schooling together 24/7. And the abuse went from manageable to unmanageable because of the forced at-home situations. And how we're overcoming that,
Just as best as you can.
Yeah, I don't have an answer for how we're overcoming that. It's proving to be one of the hardest things we're dealing with right now, especially with a housing shortage that's also coming with this time. We have very, very little housing available for rent inside of Marion County. And when they come to leave, when they're ready to leave, there's nowhere to go. There's no rental property, there's no apartment complex, there's no government housing, and Castro closed their wait list at 2 years. And that is it. We're outsourcing to our friends in Hamilton County and Chattanooga. And that's even harder because people inside our county work, live, go to school, and have kids inside Marion County. They aren't able to shelter in Chattanooga and drive back and forth every day for work or schooling kids.
And I'll add, for us here in Chattanooga, it has been an adventure, to say the least. And absolutely, we have seen that. We've seen that increase in cases and the severity of cases, but also, especially in the midst of the really bad part of the pandemic, saw a decrease in people reaching out for help because they couldn't, because they're trapped at home with their abusers. And resources here are so limited as well. Like right now, for those kind of inner area, just to know, we're at capacity at our shelter right now. And so we're having to reach out to other shelters, and we're getting we're at capacity too. So you know, it does really feel right now like all of our hands are tied, and the housing crisis is absolutely present here as well. A lot of the folks that we have in shelter are staying longer than they normally would because there's nowhere for them to exit safely to. It's a real compounded issue. And hopefully things will open up a little bit more. I'm feeling very hopeful about kind of things improving, fingers crossed, but things are limited and things are tough. But we're here and we're sticking to it and doing the best that we can.
So I can just reiterate everything that they said. Shelter is full, calls are up. Now we went through a period as well where calls were down because people couldn't call. What we did see was lethality increased, even though calls were down. What we saw when police were responding to domestic violence calls, that lethality increased. So their number of calls went down, but the lethality of the cases that they were responding to went up. And so because the court shut down for COVID, the backlog is outrageous. And so we're not even through that from last year. And so many cases are just getting dismissed and put to the side because they've been on the docket for so long that there's not a lot that they can do for those because, you know, people aren't showing up now because it's been on there for so long, and, you know, it was going to be continued to be dismissed anyway. And, you know, it's just it's a compounded issue, as she said. And so same thing with our shelter, they're staying longer. We have a transitional housing program for people in our shelter where they can exit, and we will assist them with rent and utilities for 6 months, but we can't find them a place to go to pay for that transitional housing program. Our housing authorities are backed up. We have 7 counties that we serve, and none of them, landlords that we've worked with, because of the eviction moratorium that was in place, they couldn't get people out that weren't paying rent, and now they don't want to evict people, or the people, you know, had the money to get. I mean, it's a compounded issue all around. And so our shelter is full, it has been full. You know, we had to lower our capacity at some points because we had COVID in the shelter. You can't intermingle families. I mean, it's been, and not to mention the effect on staff, because their families have been affected by COVID and they have been affected by COVID, and you know, all of those things, and trying to maintain all of those things, because sometimes we forget the people that are actually working with all of those things too. And so it's been, like she said, an adventure. I think that's a very good word. We should coin that. It's been an adventure, a big adventure. So I'm gonna be glad when it's over. So I don't know if we have normal in this business, but I'll be glad when we get back to normal.
Well, and Sarah, thank you too for mentioning the impact on staff, and that a lot of our agencies have been running very short staffed from folk. There's been a lot of turnover. That's been an impact of this, but also folks having to be out to quarantine, to folks who've had COVID or have had exposure or have a family member they're caring for. And so, you know, I just have mass appreciation for my team and the folks who've had their boots on the ground from the beginning of this and didn't get to work from home. And we've been in the middle of it the whole time. So I'm sure you all's agencies, so much appreciation to all of you who have also been in this situation.
And I think they don't get classified as first responders. And so I think that that's an oversight on, a lot of people's part, is that, domestic violence doesn't stop either. And so our shelters don't get to shut down and do that. And so they don't get classified as first responders. Crisis lines don't just go away. And we're not the only ones, so I'm not saying that, but I just think across the board, those kinds of things don't get to happen. And so they're not necessarily recognized for that. And so, it does take a toll after some time in dealing with that. So.
And just to reiterate, thank you guys for all you do, like, because it is insane on a normal day basis. I can't imagine during this pandemic, and just seeing it from my perspective with students, like just being concerned about them not being in the classroom. Like, we have a wonderful Center for Women and Gender Equity, and Sarah Peters is just great here. And she works hard, but like with the students not being here on campus, it's hard. Like, I was immediately worried, seeing all the figures that you guys see with the increase in rates, and the, with that, and child abuse, just family violence in general, with everybody being home and out of work, and just with students, they're not in the classroom, we can't see them and see those changes in grades and their demeanor and behavior to kind of like say, hey, is everything okay? And that's what I have to think about from my end is, how do we check in when you're in an online classroom and I see you more visibly in a in-person space, and we have all these activities that Sarah puts on here, that we're just now getting back to having students take back the night, and all those kind of events are now coming back, and we really reach people that way. And it's a crazy world we're having to operate in with limited resources and challenges like we've never seen before.
Yeah, and I think that goes into our next question, is if we think an individual needs help because they're in an abusive situation, what are some tips, or what are things that we should be looking out for, whether it's in person, or if you found some tricks, Christina, to notice those things on Zoom, any tips or tricks for that?
I have no answer for the Zoom thing, because that's a whole new different operating field, and so awkward in a class of like 70 folks where they don't like to have their cameras on, for students at least. But like, oh man, so you said warning signs, right? Was that, yeah. So I just think, I'm a big podcaster. I don't know about you guys, but I think that's an awesome, like, listening to podcasts is an awesome educational tool. And one that, I'd heard about that great tool, like love bombing. Like, that is a warning sign when people start talking to people about, I have this person who's really intense that they meet, and they start talking about how much, they're giving me all these gifts and showering me with this affection, but it's a little, they have that gut feeling, that warning sign of, but something seems off about it. They're rushing into this so much, and they want to, they're kind of using it as manipulation and controlling all my time and who I see and taking me places. I had never really, I heard of it, but like, I listened to a podcast called Something Was Wrong. I don't know if you've ever heard of it, but it's all about love bombing and how that leads into this emotional, coercive control type situation. And it's just such a very interesting kind of warning sign and tip, that when somebody tells you about that, kind of go, does it feel like you're getting taken away from your normal behavior and your friends, and like kind of walking people through that in a non-judgmental way, empathetic, and saying, let's look at this at a different perspective. Is it that gut feeling? We might ought to check into that a little bit more and think about, is this a healthy situation, or is this going down a different path?
I think that's the most important thing. I think we kind of alluded to it earlier, is reserving judgment. which is super hard, right? When you're especially when you're talking to about somebody that you care about or that you really know, and you feel like there's something going on or that there's a red flag. But when you're talking about warning signs, I mean, we would all be very rich if we could like pick out abusers in a crowd, right? And be able to say, well, this person is definitely, or this person is definitely, but we can definitely say that there's some red flags or signs that are not good, or you need to be concerned about more than others. And I think she described those very well. But when you approach somebody about those or try to talk to them about what that looks like, being a supportive person around those and knowing that because they do have to, they're the expert in that, they have to be the one that makes the decision. That 7 times leaving is a real true thing. And so trying to force that on somebody is not ever going to benefit you or them. And so reserving that judgment, and just being a supportive person and being willing to talk to them about staying safe if they're going to stay there is a really big deal, because they know then that you're going to support them whether no matter what. And so they will feel comfortable even if they have to come back to you later on. And I think that is a really big deal in the long run, right? Is that I know that I have a safe place to come. So, because if I have judgment and I say if I say things like, if you don't do this, then don't come back, then I'm cutting off, their sources of relief when bad things do happen. And so I think you really have to separate yourself from that when those kinds of things happen. But yeah, jealousy and isolation, all those things on the power and control wheel, when you, even with young people who tend to think, oh, that means they really like me and all that kind of stuff is, red flag. But saying that in a really non-judgmental way, like, maybe you just want to keep an eye on that, and maybe this is how you can be safe, those kinds of things. And if you're gonna do that, how can you do that safely versus don't ever go out with them again because it's not safe, kind of thing. So, which is hard when it's somebody you care about, I think.
I think that's really important, the idea that to be prepared. So if somebody tells you that, you don't go to that gut instinct of you need to go, you need to get out, like that's hard to do because, we all know it's like very dangerous when you leave, and that's a carefully thought out process that needs to happen. So reserving that judgment and like really validating their experience, I think is important. And reiterating, this isn't your fault, because we know self-blame is very natural in these situations, and people go there saying, this isn't your fault. And then listening, I think that is a big thing. And like, we all want to go, oh man, at least he didn't hit you, or, minimize, that kind of stuff. But just listening, I think, is like a huge thing that people can just do, and like tips there to keep you from, hearing those warning signs, pointing it out, asking questions that aren't like, listening is key there.
I think that's actually probably the most important thing that you can do for a friend, a family member, as somebody you care about, who maybe you're seeing the warning signs. Sometimes it's easier looking in from the outside. Maybe you're seeing something, and just listening. Sarah, I like that you said reserving judgment. And I think too, we sometimes have the impulse to want to fix or want to save and want to take some action. And this is my counseling background coming out. My PhD's in counseling psychology, but sometimes you don't fix, you don't take that action, you just listen and just be supportive and non-judgmental and just be there.
I like to tell people that I always try to remember, like when I was growing up, that we all had friends, or we all had a boyfriend that our mother didn't like, and inevitably you always came home and told your mother like something bad that this friend or this boyfriend did right to you, and then your mother automatically hated them forever. And then in 5 minutes or an hour, you were over it and you wanted to go hang out with them again. And your mother was like, no, I hate them forever now. That's how a victim feels, I think, when they come and tell you all these bad things, and then you like tell them all of your judgments, right? And so now they never want to come and tell you all those things again, because you've just told them all the bad things you feel about that person. And so I try to train our staff and tell people that when they're trying to talk to people they care about, like, don't be the mama of that. Don't try to fix that or be mad at that person for them. That's their business. You just need to be the listener, the supporter, the, whatever, because you want them to continue to come and tell you all the things. You can say all the bad things when they're gone, but not while they're there, because we've all had that happen to us and then felt like we could never tell them something again. And we don't want to do that.
Yeah, and thank you all so much for touching on the warning signs too. I know I've also been in a domestic violence relationship, and like going through trauma therapy, like realizing all the obvious signs that were there on his part, but then also all the obvious signs where if I'd like really listened to myself and been like, this situation makes me feel unsafe, this situation makes me feel this way, and actually like done something, then how it could have been different. Through therapy, I've also learned that, some of the reasons I didn't notice some of those warning signs is because I was raised in an abusive household as well. So how can we help young people to understand this type of abuse? And especially when you think about the cycle of violence, how can we work to break those cycles?
I think that goes back to that early education, and talking about those things early on, and getting that information out there. A lot of times we don't want to expose people to things too early, or we think they're not grown enough, or like Christina said about getting out of what we normally do and who we normally talk to about things, and be creative about that and how we present information to them, because it's not, we can talk about it in a lot of different ways. Healthy relationships, we need to talk about that in a lot of different aspects. And so, it's been taboo to talk about your home relationships and your intimate partner relationships for forever, right? But the more we talk about it, the more people will know that that's not okay, or that doesn't feel right, and I should probably tell somebody about that early on. And then, this healthy relationships will be more the norm than unhealthy relationships will be more the norm. And then holding people accountable for their behavior, instead of making excuses for that behavior. Because again, something bad happens to you doesn't give you the license to continue that, or to be to act bad to other people, or to portray, continue that with somebody else. So
I think too, the more we can promote empowerment among young folks and include that in our education efforts of young folks, and kind of teaching people what it feels like to be empowered. That's one of the things that we really hold strongly in our value set. So many folks coming out of abusive relationships have been disempowered. Their power has been taken away. So our goal is to give it back. You have power, you have choice, you have autonomy. And if we can, I don't know how, I don't have any grand ideas on necessarily how to do this, but incorporating that empowerment with our young people from the time they're little, giving little kids choice, teaching them that they have a choice, and then when someone's trying to take that choice away, they know that feels icky. That doesn't feel right. Yeah, I don't know where else to go from that, but empowerment.
I really like the idea, like I've been reading about it recently because a student got interested in it for her thesis of peer education programs, like training kids to, or like adolescents to talk to other adolescents. Cause I'm old and like, so talking to, they're going to look at me like, I don't want to tell this lady about my life. She doesn't get it. She has kids, all this kind of stuff. But like peer education seems like a great way. And there's some great programs out there where you can like integrate even like parent pieces into it. It's just getting schools on board, which is an interesting, dynamic there. But, having other students who are passionate about this, because you'll find them, they're out there and they want to change the world, and finding those folks and training them on how to talk to their peers about this kind of issue and bystander intervention, all that kind of stuff is just great and so promising and exciting. I think teaching, and that kind of goes back to the cultural aspect we talked about earlier, is teaching young people to start challenging what they see among their friends and their peer groups. And I think getting them involved in it will have a bigger impact than just kind of like broader efforts. But having the resources to do that's one thing, and getting that out there.
I love that idea of peer, talking to your peers. I think they can talk to each other in a way that makes sense to them. And that's such a great idea. I know on our end, we're really into healthy relationships, but I think it goes a little bit further into, educating about consent and bodily autonomy too. And when we're going into empowering, I think information and empowering them with knowledge about what feels good and what doesn't feel good, going back to that intuition and then taking that into the healthy relationship piece. Because if they're coming from a family who doesn't already hold those values or have that going on in their own family, that could be very difficult for them to even see or pick up. And so equipping them with that information, and I think empowers them too. So we're at like 10 minutes till, and the one thing that I think is probably the most important is resources, because that's what we've talked about all night, is like just having access to resources. But I do want to point out specifically for young people, are there specific resources in your area that reach youth? Are there community centers or schools or churches or organizations in your area that's doing this work with your youth already? Yeah. And Sarah, I remember you saying that you had an Avalon ambassador program.
Yes.
That's awesome. So it's kind of like a peer thing like Christina was talking about.
Yes.
That's fantastic.
That is incredible. And here in Marion County, there are very few resources, period. There are no resources that are targeted to our youth that I know about. I feel like if there was one, it would be in my face and I would be part of it. We're just lacking resources. I mean, there is no better way to put it than we're lacking resources, and what little bit of resources that we do get from outside or from Hamilton County, they end up getting terminated or cut off after a certain amount of time. And we're just grasping at straws to have resources available for our women and our youth.
We're very lucky in Cumberland County and our surrounding areas. They do focus a lot on youth and a lot on not on domestic violence and sexual assault. Don't get me wrong, they don't focus on that. We have to really push for that part of it, but they do focus a lot of effort on youth and educating them on just different issues. So we can kind of piggyback on some of those things. You know, sexual violence is not a topic that anybody wants to talk about, and especially they don't want us to talk about that with children, because children in this area do not have sex, is what people believe around here. And so that's very hard to talk about. So we kind of skirt that with talking about healthy relationships, and inevitably that might come up in that area. And so we can maybe get that in with that. But we do have a children's program at the Avalon Center that is dedicated to that, where children get advocates that are specifically assigned to them if they've been victims of domestic violence or sexual assault, or they've been witnesses to. So if their parent is a client, then they can get assigned their own advocate, and that will work with them on their own issues. And that same program does prevention education in all of our schools. And they do that from kindergarten all the way up to 12th grade with different types of curriculums for anywhere from the hands are not for hurting, bullying curriculums, healthy relationships, those all different kinds of things. And so they work with the schools pretty closely, and other like groups in the community like Boy Scouts and all those kinds of groups to have programs with the kids and in the summertime and those kinds of things. So we are pretty lucky in our counties that we get to do that. So there are some resources for us around those things, but we always need more because we have still lots of issues. So.
Yeah, we definitely need more resources for our kids and youth in the Chattanooga area as well. But we do have some good ones. We partner quite a bit with the Child Advocacy Center. And I am not super knowledgeable about their services, so I don't want to lead people wrong. So I'll just point people in the direction of looking them up to find out a little more about what they do. But under partnership itself, we have a program called the River City Youth Collective that they actually mostly serve youth that are aging out of foster care, but they can also provide some services to youth who have been the victims of crime. And there's a newer program, and again, I have some limited knowledge on it, but it's called Camp Hope, that Partnership has started, and it offers a summer camp for youth who've kind of been through these things, to help them connect and to help give them kind of a positive peer group. And I believe that they also offer some other monthly programs and things of that sort. So there are definitely some good opportunities, but we always could use more.
Well, I think with Lindy, you being in Marion County, I hope you know that you can use a Step Ahead as a resource, and that you have a wonderful health educator, Mandy Easterly, out there to offer some programming around healthy relationships and consent and all of that. And that goes for everybody else. And so Rachel, if you don't mind, we've got 5 minutes left, and I do want to pull up our screen again to show some of the resources, and Rachel's going to talk about those.
Okay, so here are just some domestic violence resources that are available within our Tennessee counties. So we have the Chattanooga Crisis Hotline, and then Partnership's phone number. We have Blessed Inc. listed in the Avalon Center. The Hope Center represents McMinn and Meigs counties. The The Harbor Safe House can house individuals from Bradley and Polk counties, and then Families in Crisis can house individuals from Grundy and Sequatchie counties. So again, those main numbers can get you through to the office, and some of those are 24/7, and then the crisis lines are 24/7 as well.
Can I add something actually about our partnership number? The number you have listed there is actually more of our administrative number, and it's only available during business hours. Our 24/7 hotline is 423-755-2700. So that will connect somebody 24/7 to a crisis advocate.
So yeah, the Chattanooga Crisis Hotline is associated with you all.
Oh. You know, I didn't notice that. I saw partnership. I saw the 2822. That is us. That is partnership.
Good.
Okay, perfect. That's great to know.
Yep.
Thank you.
I just honed right in on where it said partnership.
Yeah, and thank you for all of you who work in these organizations for all that you do for your communities. It's very undervalued and underappreciated, but we know that it's so needed and we so much appreciate it. And then just with reproductive health resources, of course, any individual who lives or goes to school within our service area can call a Step Ahead's number and get a free appointment for birth control, or they can go to our website to get more information. A Step Ahead also has affiliates across the state of Tennessee. So if you don't live in the Chattanooga or surrounding areas, we can still connect you to some of our service areas in the other counties. Another great place for reproductive health resources is Simpa Community Cares. They primarily focus on Hep C, HIV, and STI testings, but they have recently shifted into primary care as well. So you can go there for a plethora of needs that you may have. And then also all the local health departments have family planning services. In Hamilton County, we have several locations like downtown on 3rd Street, a Birchwood location, Homeless Health, a location in Ottawa, and a location in Sequoia. And then all the Tennessee counties surrounding Hamilton have a health department as well that offer family planning services. So you can simply call the health department and see which days they have openings and go in for an appointment there. And I believe that's all of our resources. So thank you all for joining us to bring awareness to this challenging topic that affects so many people within our communities, within our state, and across the nation. Knowing what resources are available, how to get educated, and how to take action is so important in order to get that societal change. So just a reminder, we will be sending out a resource guide with all the information from these wonderful organizations as well as others. And we'll be sending out a survey link. So if you enjoyed this webinar, or if you didn't enjoy this webinar, please fill out that survey just so we can know how we can improve for the future or what you did really enjoy. And also we'll be sending a video link of this webinar to you. So if you want to share it with any friends or family members that you may encounter, you can feel free. Yeah. Thank you all so much.
Thanks, y'all. Appreciate having you on tonight.
Yes. Thank you all for being here. We really appreciate it.
Yeah. Take
Thank
care.
you all for hosting this. This is so
Yes.
important, and we really appreciate you all putting this together.
Yes,
So much.
thank you. If you need anything, let us know.
Same
Well.
goes to you.
Okay,
Thank you all.
bye-bye.